Today, we're getting into something really important for anyone expecting a baby or thinking about it.
That's right.
We're looking at the differences between C-sections and vaginal births.
Yeah, it's a big decision point.
Definitely. So our mission today is to unpack those key differences, look at the pros, the cons, maybe help you make sense of it all.
Absolutely. And it's helpful to start with the most fundamental difference, the delivery method itself.
Okay.
A C-section is a surgical delivery, incisions in the abdomen, in the uterus.
Right, surgery.
Whereas vaginal birth is, well, delivery through the birth canal, the more traditional route, you could say.
Got it. So surgical versus non-surgical at its core. But how does that actually play out in the experience, like timelines?
Oh, hugely different. A planned C-section, it's pretty quick, often under an hour, start to finish.
Under an hour. Wow.
Yeah, and that predictability is a big factor for some people. You know when it's happening.
Makes sense. Less uncertainty.
Exactly. But vaginal birth labor, especially if it's your first time, it can be much, much longer. We're talking like 12 to 14 hours on average, sometimes more.
12 to 14 hours.
Yeah,
that's a significant chunk of time.
it really is. A very different experience in terms of duration.
Okay, so time is one big difference. What about after the baby arrives? Recovery. How do those compare?
Recovery is another major point of difference. The information points to a longer healing period after a C-section. Think 6 to 8 weeks for a full recovery.
6 to 8 weeks.
And that usually means a longer hospital stay right after the birth, too.
Okay. And vaginal birth.
Generally quicker recovery. The estimate is usually around 2 to 6 weeks. Hospital stays typically shorter as well.
2 to 6 weeks versus 6 to 8. That's quite a gap.
It is. Getting back to feeling more normal, moving around easier, it tends to happen faster after a vaginal birth. That can be a big deal with a new baby.
I can imagine. Now the big one, pain. Everyone wonders about this. It's subjective, but what's the general picture?
Right. Pain is very personal.
Yeah.
But generally speaking, with a C-section, the surgery itself isn't painful because you have anesthesia.
Yeah.
Strong stuff.
Makes sense.
The challenge comes after. Post-operative pain, soreness around the incision while you're healing, that can be significant.
Okay, so pain after.
Yeah. Now, vaginal birth, labor itself can be, well, intensely painful. No sugarcoating it.
Right.
But there are pain management options like epidurals that can make a massive difference. And then, interestingly, the recovery pain afterwards might actually be less intense for some compared to C-section recovery.
So it's almost like trading when you experience the most intense part. Pain during labor versus pain during recovery.
That's a good way to put it. It's a different profile, a different timeline for the pain.
Okay. Let's maybe focus on vaginal birth for a moment. What are some of the specific plus sides?
Well, like we said, that shorter recovery time is a big one. Getting back on your feet faster.
Yeah, that sounds appealing.
And the information also suggests it can sometimes allow for a more personalized experience, maybe fewer interventions, options like water birth, if that's something you're interested in. And overall, it's generally seen as the less risky procedure for the person giving birth, physiologically speaking. Easier on the body in some ways, if things go smoothly.
Okay. But what about the downsides?
Oh, absolutely. The potential for significant pain during labor is obviously a major factor, though again, pain relief helps.
Right.
And labor can sometimes be really prolonged, due to fatigue, or maybe the baby's position isn't quite optimal. That unpredictability can be tough.
Yeah, the unknown length of it. Okay, let's switch gears to C-sections. What are the benefits? When is it the necessary or maybe even the preferred choice?
Well, for planned C-sections, that scheduling aspect is huge.
The predictability again.
Exactly. Planning childcare, work leave, just mentally preparing it helps. But more critically, C-sections are absolutely vital, life-saving procedures when vaginal birth isn't safe.
When it's medically necessary.
Precisely. If there's a risk to the parent or the baby. The info also points out they're often recommended for high-risk pregnancies, if you're expecting multiples like twins or triplets, or if the baby is breech.
Breech meaning feet or bottom first.
That's right, not head down. In those cases, a C-section is often the safest route.
Makes sense. What about the drawbacks of a C-section that the Mother-Baby Center wants people to be aware of?
The main things are that longer hospital stay and the longer, sometimes more difficult recovery period we talked about. And the information also mentions potential implications for future pregnancies. Sometimes it can increase risks slightly down the line, And it might affect whether you can have a vaginal birth next time. That's the VBAC question.
Ah, yes, VBAC. We should definitely come back to that. So it's a bigger medical event with a longer tail, potentially?
In essence, yes. It's major abdominal surgery, after all. Always worth discussing thoroughly with your doctor.
Okay. Now, sometimes C-sections aren't planned. How do those differ?
An emergency C-section happens when something unexpected comes up during labor, or maybe even before, that poses an immediate risk.
Okay, so it's urgent.
Very urgent, yes. The surgery itself might be similar to a planned one, but the whole experience leading up to it is obviously very different, more rushed, potentially more stressful.
Right. Is recovery different?
Generally, the recovery timeline itself is about the same as for a planned C-section, though the emotional experience might be different, of course.
Understood. And then there's the idea of elective C-sections.
Yeah, the information touches on this. Some non-medical reasons might include wanting that control over the timing, like we discussed, or perhaps a strong fear of labor pain, or general anxiety about the whole vaginal birth process.
So personal preference or anxiety playing a role?
Exactly.
Yeah.
Generally speaking, a C-section carries more risks than a vaginal birth if there isn't a clear medical reason for it.
Right. That's a crucial point. Okay, circling back to pain again briefly. The timing seems key, based on what the information suggests.
It really is. C-section. Less pain during the operation itself because of the anesthesia, but potentially more significant pain during recovery as that incision heals. Vaginal birth, potentially very intense pain during labor variable, of course, and manageable with options, but potentially less pain during the recovery phase compared to post-surgery healing.
Different points of intensity. Okay, let's shift to the final phase, postpartum recovery. What should people expect depending on how they gave birth?
Well, first off, the information stresses that postpartum recovery is a big deal no matter how you gave birth. Your body's been through a lot, hormones are shifting, you're sleep deprived, and learning to care for a tiny human.
Yeah, it's intense regardless.
Totally. But specifically for vaginal birth recovery, the typical time frame is around 4 to 6 weeks. It might be longer if you had significant tearing. If you needed stitches for a tear, those usually dissolve in about 2 weeks or so. Common things people experience are, soreness, tenderness down there, some bleeding and discharge, maybe swollen breasts as milk comes in, and just general tiredness.
And watching for infection, I assume?
Always important, yes.
Yeah.
Keep an eye on things and talk to your doctor if anything seems off.
Okay. And what does recovery look like after a C-section?
Generally longer, as we've said. More like 6 to 8 weeks for full healing.
Right, the 6 to 8 weeks.
You'll likely be in the hospital a bit longer initially. And there will be restrictions like no heavy lifting, careful bending to protect that healing incision. You'll still have some similar postpartum symptoms like the breast changes and vaginal bleeding because those are hormonal. But you'll also have specific C-section recovery symptoms. Pain, soreness, tenderness right around the incision is the main one. Maybe some temporary issues like gas or constipation as your digestive system gets back to normal after surgery. And sometimes, if the C-section happened after a long labor, you might feel generally sore all over, plus the incision pain.
Wow. Okay, so definitely distinct recovery paths. Bringing it all together, what's the main takeaway?
I think their core message is really about providing information, giving you the knowledge you need to have informed conversations with your care team and make choices that feel right for you and your situation.
Empowering parents with info.
Exactly. And emphasizing that their teams are ready and equipped for any scenario, whether it's a planned vaginal birth, a planned C-section, or something unexpected happens. They offer a range of delivery options.
So it sounds like it's really not about saying one is inherently better. It's much more nuanced.
Precisely. There isn't a single best way. Both vaginal birth and C-sections have different characteristics, different benefits, different challenges regarding the labor, the recovery, the pain experience.
Yeah.
The ideal choice really depends on your health, your baby's health, your previous experiences, and your personal preferences, all discussed with your doctor or midwife.
It's a very personal decision, informed by medical guidance. Okay, so as we wrap up, considering all these differences we've discussed, the control factor, recovery speed, potential risks, the pain experience, what aspects of bringing a child into the world do you think might weigh most heavily on someone as they make this incredibly personal choice? Definitely gives you a lot to think about. Thanks for walking us through all that today.
You're welcome. It's a complex topic with a lot to consider.